Good afternoon, and thanks for joining us for the Milwaukee County Unified Emergency Operations Center daily afternoon press briefing. We had a little bit of a change in plans for folks who were on yesterday. We said we would be talking about updates from the House of Corrections, but with the governor's announcement today, we thought we would push that to tomorrow so we could focus on reaction to today's announcement of the extended safer at home order. So we do have one addition to the lineup that was sent around in the media advisory today. In addition to Milwaukee Mayor Tom Barrett, Milwaukee County Executive Chris Abele, Health Director, Medical Services Director Dr. Ben Weston, and Health Officer for Greenfield Darren Roush, we do have Brian Kennedy, the mayor of Glendale, joining us as well. So I believe, Mayor Barrett, you're starting us off today.
Thank you, Brian. And as Brian mentioned, the governor's decision and announcement to extend the stay-at-home, safer-at-home order through mid-May is not a surprise for many of us. I think we could see for several days that he was foreshadowing this decision. And I think it's in some ways a sign of the success that we have had, that the fact that we are seeing a reduction in numbers means that we should stay the course right now and should continue to do what we've been doing for the last month, and that is to have everybody play a part in trying to make sure that we can work through this pandemic. So it's a difficult decision, I'm sure, for the governor, but it's a decision that we're supportive of because we want to see our economy come back. We want to see people be healthy. And the best way for us to get our lives back to normal is to continue to do what we've been doing for the last month. We know, again, that this is causing a hardship, an economic hardship, and all you have to do is look at the unemployment claims and see the difficulties that small businesses are having. And I am very sympathetic to that. And so what I want to do here at the local level is concentrate on those steps that we can take here so that we can, as quickly as possible, defeat this pandemic and get our economy moving again. And one of the keys to that has been identified by virtually everyone who's looked at this is making sure that we have more expansive testing. And so a lot of the energy that I've been spending and a lot of the energy that Commissioner Kowalik has been spending has been to work with the state and work with others to see what we can do to achieve more testing here in the city of Milwaukee. And to put this in perspective, in Winnebago County, they have 30 cases. In 2 census tracts, not zip codes, but census tracts, which are very much smaller than that. One on the far northwest part of the city of Milwaukee, which is not that far from Brown Deer. And I see President Montgomery on the picture as well. The other in the northeastern part of the city of Milwaukee, just north of Capitol Drive. Both of those have 30 or more positive cases of COVID-19 in one census tract. So we have as many in one census tract as you'll see in all of Outagamie County, which is where Oshkosh is located. I'm sorry, Winnebago County, where Oshkosh is located. So that underscores just the intensity that we're seeing with COVID-19 in parts of the city of Milwaukee. So then the obvious question is, all right, how do we move to more testing? How do we get more testing? And for the first couple of weeks that we were dealing with this, the real issue was that we had to make sure that our healthcare responders, our healthcare workers, as well as individuals in the hospital, that they receive the testing. And we basically have accomplished that to a considerable extent. The next place to go, of course, is the first responders. And that's something that is still a work in progress. But we think that is going to be a key to allowing us to go then for more localized testing. And what I want to see is more community testing that will allow us to go to some of these neighborhoods that are truly hotspots and do more testing in these areas, literally right in these areas, many of which are not served by hospitals and physicians' offices. That's the challenge we have in Milwaukee, is that there's a considerable amount of people who, when we say work through your provider, they don't have a provider. They simply don't have a provider. And so we have to be responsible and do what we can to make sure that they can have access to the testing as well. So again, to take a further step, one of the announcements that was made in the last several weeks was the partnership with Exact Sciences. Exact Sciences is a company out of Madison, which does tests for so people don't have to have colonoscopies. It's an at-home test to make sure that you don't have colon cancer. But they have the capacity and the capability also to do testing for COVID-19, and in fact have entered into agreement with the state of Wisconsin to provide literally tens of thousands of test kits to the state of Wisconsin. At this point, the demand for those test kits is not there. And what I want us to do here in Milwaukee is I want us to work with the state of Wisconsin, with Exact Sciences, and see what we can do, not in weeks, but literally in days, to bring those test kits here so that they can be implemented in our community. And so I've had conversations with Dr. Raymond at the medical college, with Weston. I've been talking a lot to representatives from the state. Obviously, Commissioner Kwolek is very, very, very much leading this effort to make sure that we're going to have community testing. That's important because we know that it serves two purposes. One, it allows us to literally study this issue. And when I say study this issue, it's important for us to be in the community to see exactly what's happening. But to me, even more importantly, is to the extent that we can identify individuals who are positive, we can take steps that are necessary. And those steps, of course, are to test them. And if they test positive, to make sure that they are isolated and quarantined, and then to do the tracing, which is the third part of this, and where the state, again, has stepped up in a significant way. I think the more widespread we can have that testing, that isolation, that contact tracing, the quicker we're going to be able to lift this order that in essence closes down major parts of our economy, because we're going to be able to more surgically identify those individuals who are carrying the virus and deal with them on a more specific basis. But right now, there are still a lot of people who they're afraid to go back to work. And we have to be mindful of that. And we have to be mindful that even with the progress that we have made up to this point, that there is still a lot of work to be done. And the worst thing we can do, even though we're seeing some evidence that the stay-at-home order is being successful, the worst thing we can do is to take our foot off the gas. So again, I am very concerned about the economic impact that this is causing people in their individual lives and in businesses. I'm very concerned about that. I think as all the people who are on this broadcast are concerned about. But I truly believe that the best way for us to get back to normalcy is to squash this thing as much as we can. If we take our foot off the accelerator too soon, my fear is all we are doing is we are permitting a return of this with a vengeance. And what we know from history, what we know from the 1918 pandemic that affected this country was that it really came in three waves. There was the first wave in the first part of 1918, and then it subsided, but it came back with a vengeance in the fall of 1918, and then the following spring. So we have to, I believe, stay vigilant and work with the state, work with each other, and work most importantly with our health community and our public health experts so that we can do everything we can to, again, get back to where we all want to be. So with that, I'm going to turn it over to County Executive Abley. Thank you very much.
Thanks, Mayor. Just along the lines of what the mayor was saying, relative to the governor's order, I agree. It was something that I think we expected, and I think it's something appropriate. One of the metaphors I've been using is if you're in your house and somebody smells smoke and you discover there's a fire, you don't put the fire most of the way out and think, you know what, we got it. I'm going to go sit on the couch now and watch the rest of, Lost reruns. You put the whole thing out. And I absolutely want to get businesses back to work. And it's not just businesses, it's the jobs. That's what's important. There are a lot of resources. The county's put up a site that lists a lot of the resources that people can have, that employers can have, and particularly small businesses. MMAC has done the same, and I encourage people to check that out. The mayor, myself, the state, we are all working on getting as many resources to help us get through this. You probably saw recently at the airport, we got just about $30 million which it may surprise you, given the downturn in traffic there, buys us months, not a year of operating. But we're going after every dime we can, and that's something we'll do aggressively. I just want to reiterate, this is not about, progress doesn't mean you let off the gas. We still don't know because we had this big election and thousands of people, and just because it was a few days ago, and in this crisis, we tend to think about day-to-day news. As has been pointed out, we're not going to see if there's a significant uptick from that until towards the end of this week. And again, the worst thing we could do to get businesses back to work safely is to relax here. And I know the governor wants to see people getting back to their jobs. And the way I think to think about it is less about a date, but about the variables that we've been talking about for a while. The 14 days in a row of declining increased case numbers, the capacity at hospitals, where all hospitals having more than enough capacity to take an increase. We want to make sure we're doing this not on an arbitrary date, but when it's safe. Part of why the county has added more of these details to the dashboard, and the one on hospital capacity, which we talked about the other day, the one that shows each day's increase or decrease in the number of cases, or new additional cases, where you can track that, is to make that line visible. But I think this is the right thing to do. And honestly, all of us looking back, a couple of years from now, would all rather apologize for being overly vigilant and keeping us safe than apologize for wanting to get back to work too soon and causing another giant uptick, as the mayor has said, is what happens. We've seen it again and again. That's not an abstraction. It is what happens. It's reality. With that, I will turn it over to Dr. Weston to talk about today's numbers. As you all saw, we hit a break point that's not a happy one to see. The fact that we've got over 2,000 confirmed cases is not something to be excited about. And that's an awful lot of people and an awful lot of lives, and it's all of their families and the people they work with. And we just need to think we can never let these numbers become an abstraction. These are people and lives. Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. So as the County Executive mentioned, we are over 2006 to be exact, cases in our county, and 103 individuals who have died. We are seeing an apparent trend over a few days of increasing numbers of cases the last 3 days. So we'll certainly keep a close eye on that and see where that goes. As we discuss the extension of the stay-at-home policy and when and how to pull back any policies in a measured manner, there are 4 main areas that we as a city, a county, and municipalities are watching closely. So first, we're monitoring our local numbers to ensure that we have a sustained decreasing trend in new confirmed cases of COVID-19. And this is not just over a couple of days, but more on the scale of a couple of weeks to consistently see declining numbers. Second, we want to confirm that we have an adequate number of tests and the ability to run those tests. It's no secret that there's been and continues to be a national shortage of available testing supplies and testing capacity. As the mayor mentioned, we're working at a local as well as a broader level to enhance our testing capacity so that we're able to evaluate those in need. Third, once we have a positive case, we want to be able to effectively trace their contacts and work with that patient to receive treatments or isolation as is appropriate for their case. And our health systems, our health departments have done an outstanding job working together to maximize their capacity on patient investigations. And fourth is health system capacity. And so as we've discussed, there's a variety of models projecting how COVID-19 will affect our community in the future. And while they differ in details, what they all have in common is the emphasis on social distancing as the key element for slowing the spread of the disease. And likewise, all the models that are now emerging, including our own from the Medical College of Wisconsin and the UWM-Zilber School of Public Health, show that certainly abrupt, but even gradual loosening of the stay-at-home precautions will result in an increase in cases and an increase in need for hospitalizations. And while this doesn't mean we can never pull back on social distancing, it does mean that it must be measured and that we need to be prepared for what is to come. And in this preparation, we've ensured that our fire, our EMS, our 911 systems are able to care for an increased number of patients and allow those patients to reach a facility that can best care for them. Additionally, we've worked with our hospital systems to maximize the number of patients they can treat effectively and that they have the resources needed to do that. And we're preparing our alternate care facility to be ready should an increased number of patients arise. So through these 4 key steps, again, monitoring trends, maximizing testing ability, optimizing tracing efficiency, and ensuring EMS and healthcare system capacity, we're preparing for what is to come. And we are making progress. Stay at home is working. Our curve does appear on initial review to be flattening, and that is due to these efforts. And as I said yesterday, this is a time for ongoing diligence in social distancing to ensure that we continue to move our trend in the right direction. Thank you and stay safe, and I will hand it off to Darren Roush.
Thank you, Dr. Weston. I'm happy to be here today representing our health departments in Milwaukee County. And with the governor's orders today, we certainly wanted to talk about setting expectations about what happens after those orders end next month on May 26th. It's important to know that things will not go back to normal on May 27th. Over the last several weeks, the Safer at Home order has slowed the spread of COVID-19 in Milwaukee County. We know that there are fewer people who are sick because of this order, and we also know that lifting the order too soon will put our community at risk. Public health experts are closely monitoring those 4 things that Dr. Weston mentioned to determine when the Safer at Home order should be lifted, and a measured approach is appropriate in going forward. So I wanted to take some time here today. We do have some epidemiological data about the situation that I can share today, and it does really emphasize the importance of the continued Safer at Home order and the continued need by all Milwaukee County residents and residents of the state to continue to do the things they can do to limit the spread of COVID. On my screen here, the first slide I want to show is looking at cumulative cases of COVID. This is across the state in black, in Milwaukee County in purple, the Milwaukee metro region, which is the 7-county area, in blue, and then the Waukesha, Ozaukee, Walworth counties in green. What we see here is that our doubling rates for COVID infections, early on, we were doubling in a day. We were doubling in 2 days. More recently, as we get out here to 30 days since the first time we had 20 cases, we're seeing that doubling rate decrease to 8.8 days. So that means the rate of cases we have in the county is doubling every 8 days. That is a sign that flattening is, we are approaching flattening the curve. We are approaching that apex. Additionally, I have some more slides I'll show here, more graphs here. I'll show about demographics of confirmed cases, and we can certainly share this with the media electronically after this press briefing. But you see here, rates are still continuing to increase. This top left picture is just looking at overall numbers of cases. And with every one of these stair steps, that represents an increase in cases each and every day. On the right here, we see the difference by age. So those in their 20s and 30s are this third line here. This disease is mostly impacting those in their 40s and 50s in Milwaukee County. We know race and ethnicity has been a trend, and we see a large number of Black or African American individuals in the county that have come down with COVID. Our white race is here in blue, and we do have a large number of unknowns that we're still looking to figure out what they are and ascribe the correct race and gender, race and ethnicity to them, excuse me. And then on the bottom right here, we see gender and the differences between males and females are having more cases of COVID. We also have these data tables by hospitalizations and by deaths. And so we can certainly share these later. I want to mention, though, as the county executive mentioned, these aren't just numbers. These are people's lives. These are, people in our community that have come down with this, and their families and themselves have been significantly impacted. Testing was an issue that was raised by Mayor Barrett. Here we have a graph of testing coverages daily, kind of a cumulative look at both negative tests, which we're nearing 10,000 negative tests, and positive tests, where we have 2006, as was mentioned earlier. Weekly, we can look at that data here, and we can see that there's been generally a leveling of testing with a slight decrease last week, and positivity rates are pretty much consistent over that time. But to Mayor Barrett's point, I want to echo that to do the work of controlling COVID well, the next step we need to take is to really increase and enhance that testing capacity across the healthcare system. Lastly, I have a set of spatial maps, and this first map is a crude incidence map for COVID, so newly diagnosed COVID across the county. This particular map covers the entirety of the pandemic, so March 12th through April 15th, and the darker red color means the higher rate of COVID disease, the higher incidence of disease, and you can see that we have some pretty significant areas where there's lots of disease going on throughout the county. And then you can see on this map, we are looking at just what's been happening in the last week. So this is April 7th through April 13th. So these maps are very important to us in public health as we identify the hotspots, as we identify where we need to intervene, educational messages, and the aggressive testing and outreach that we can do to certain communities throughout the county. So with that, I will stop sharing and turn it over to Mayor Kennedy.
Thanks. And go ahead, Mayor Kennedy.
All right. Thank you very much. Appreciate that. So I don't know that I have a whole lot of additional information to add other than to really sort of, I guess, underscore some of the messages that have already been given. I do believe that, those of us in the suburban communities are, in agreement with the things that Mayor Barrett said earlier, especially his call for increased testing. We know that when we have a limited amount of testing, those numbers that are not necessarily the most accurate. We may have many people that have been exposed and experiencing mild symptoms, and until we have the ability to greatly increase testing, we really do need to continue with the governor's stay-at-home order. I would say that from what we've seen, his order is working. We are seeing a flattening of the curve, and I would say that the governor did the right thing today. I've talked with a number of my colleagues today, and it's interesting. Everyone I talked to today from the suburban communities said that they believe that this was the right thing to do, that it is a hardship on many of our local businesses, but to keep things closed for a little longer, keep people at home for a more extended time will help us to continue to not max out our healthcare system, and also to be able to get this thing under control. And lastly, I believe that we will need time, and the governor's order today does give us additional time to be able to put in place the kind of plan that will allow people to return to work, to allow businesses to open, to serve their customers, and to engage in full services of the services they provide, particularly our bars and restaurants. But we need to have a plan in place to be able to help those business owners to be able to engage with the public in a way that keeps everybody safe, and allows them to have time to train their employees as they get ready to reopen. So just underscoring a lot of the messages that have been given, and to say that throughout the county, the mayors I spoke with today are in full agreement with the things that have been said in this call by our suburban health officer, Darren, as well as Mayor Barrett and others. So thank you.
Thanks very much, Mayor Kennedy. And we also have President of the Village of Grand Deer, Wanda Montgomery, with us to provide some additional reaction from suburban mayors. President Montgomery.
Thank you. And thank you again for this opportunity just to share my perspective. Of course, I'm working from home, so I didn't see the governor's extension until I started getting messages from people. And as I think about that, he has our best interests at heart. And I know there are a number of people who are probably planning things that they wanted to do after next weekend and maybe into May. But this is something that we really have to take to heart and really follow these directions. As I think about this past Friday, when I had an opportunity to share my perspective, I had a number of people who reached out to me via my official email and through Facebook, even a person who had just gotten off work from one of the healthcare systems and just shared how much she appreciated the words that I spoke. These are people that are on the front line, that are going in every day, that are working to make sure that our loved ones, our family, and our friends are recovering from this. We know that we have a number of people who have passed away, and it's horrible. But what can I do? I mean, what I'm doing now by staying at home is really helping to flatten the curve, to actually keep those people that are going to work every day to have a better chance of not being affected by this. I shared on Friday and I'll share today. I come from a family of 9 children. My mother is still living. I love to see my mother every week. I've not seen my mother in over a month. I have my siblings. We get together once a month for family dinner. Have not done that. We plan a lot of events, but in order for us to be successful, I want to be able to continue to do those things. So what I would say to each and every one, let's practice that social distancing. I didn't know anything about social distancing before we heard about this pandemic. I love to be close to people, but right now I'm staying as far away as I can, not being funny about it, but it's important that we support each other through this. Wash your hands. Make sure that you don't go out when it's not necessary. You can go out in your yard. You can take the walks, ride your bike. I'm participating in a jump for joy. I've been jumping rope either in my garage or in the driveway. But what I would say is grandmothers and mothers and aunts and uncles, this is affecting our community, the African-American community, more than it is anyone else. And we need to do our part. If you know of somebody that's just gonna go out and do what they wanna do, try and get to them and let them know. Tell them who you know who's been affected. I've seen too many people, and this isn't old people. These are people that are younger, that are being impacted. And maybe if they don't get the COVID-19, they might be a carrier that exposes somebody else. So how do we really work together? This is about community. This is about community. If we don't support each other, we can't expect anyone else to do it. This is a small part for us to do to make a difference. Thank you.
Thank you so much, President Montgomery. And since we have a question for you, I'm just going to jump ahead to that question really quickly. This is from Bruce Vilmetti with the Milwaukee Journal-Sentinel. And he asks for President Montgomery, the map of recent hotspots shows brown deer. Can you,
Right.
And do you have any sense of why?
No, I don't. But what I can tell you is some of the things that I've heard, because residents do reach out to me. We still have people that are going out. Kids are going out, playing on the various playgrounds, basketball. They're going to the school property. And these are not always teenagers. Sometimes parents are taking their kids out for a break. And we have signs up. We have things, we've taken down rims. So we really need to, and I've been promoting it, the village has been promoting it, the North Shore Health Department. So that's why wherever we can, and I have a pretty active social media, but it's not just me, it's spreading the word. We need to each one reach one. And so because I heard that today, just like you did, brown deer, we got to do better. And so whatever I can do, I will.
Thank you so much, President Montgomery. So next we're going to jump to some questions. I believe the first person that had some questions was Derek Rose from WISN. And give me just a second to get back up to those. Okay, so we're already at 4 o'clock here, so we're clearly going to go past our half hour timeline, and so I hope folks can stick around, and we'll try to get through all these questions as quickly as we can. First one's for Dr. Weston. Which assisted living senior care facilities in Milwaukee County have more than 5 confirmed COVID-19 cases?
Sure. I think the health departments have been spearheading most of these questions, so I might defer to Darren Roush on this one.
Yeah, so my comment to that one is, while we're not identifying any specific long-term care facilities for purposes of confidentiality and HIPAA protections, we do want to make people aware that long-term care facilities do contain a vulnerable population, and it's not unlikely that several long-term care facilities have at least a case. It's well known in Greenfield that I have a facility, a memory care facility, that has significant cases, and we've been addressing that with them for several weeks.
Thanks, Director Roush. Next question for Mayor Barrett. This is also from Derek Rose at WISN. Milwaukee police have been arresting individuals and issuing citations for violating the Safer at Home order. Now Governor Evers extended the order to May 26th. Should the president announce that he wants the country to reopen at a date earlier than May 26th and a business opens or individuals are out of their homes, whose orders should officers follow in terms of enforcement? And will a person or business be cited for being open or out of their home if they are following the president's decision?
I think the question actually has a couple different verbs there that are important. The question is, it states that the president announces that he wants the country to open at a date earlier than May 26th. I want the country to open at a date earlier than May 26th, and I think everyone here wants that, but we also want it to be safe. And so what one wants, as opposed to what the gubernatorial order is, are much different. So what the governor's order is it's a matter of law. And so in this situation, obviously the president has a political decision that he's making in terms of what he wants and what he wants to say. But the decisions are basically decisions made at the state and local levels. Because if, for example, the state were not to continue this order, local units of government would likely have the authority to do that. And so this has oftentimes been the case when it comes to health decisions in particular. The local health officers have a tremendous amount of authority in these situations. But as it stands now, when the governor issued his order, what he did was that he issued that to be a statewide order. And so that's going to preempt any local orders. But again, to answer the question the most succinctly I can is follow the governor's directive, because that's a legal directive as opposed to a wish. And I don't say that sarcastically, that's just a matter of fact.
Thanks, Mayor Barrett. So the next question is for County Executive Abley. Since county golf courses are one stream of income for the county, what is the plan to relax the restrictions on those facilities as well as enforcement? Also, after saying we should expect furloughs in county government, what is the number of county employees and departments that will be furloughed?
Right. So as to the first question on golf, I was thinking as I was reading the question of way back when, those Orson Welles ads he used to do about, I think it was for Ernest and Julio Gallo, where he said, "We will sell no wine before it's time." We're not going to open the golf courses until it is 100% safe to do so, by which I mean not just people think that they can go golf and promise that they're going to stay away, that our staff are going to be able to make sure that actually does happen. And trust me, I would love to have the revenue. I'd love to have the revenue that we get from the beer gardens. But the issue here is about safety. And that is always the top priority, and it absolutely has come at a cost. We've already had to make tough decisions. We've already had to defer freeze new hiring. We've had to defer all raises and bonuses. And we will be furloughing around 200 seasonals. And there's probably going to be more to come. And again, this is because what our focus is on preserving the services that your viewers pay for. We want to make sure, starting with safety, that we are able to provide as much as we can. And I just want to take the opportunity to underscore the point that, as I said the other day, and you heard from the mayor as well, we both appreciate the state passing the response bill that they did. We're going to need more resources. We are burning through a lot right now. You heard me mention that, we got this federal grant to help us at the airport. It's about $30 million, and that's just the airport, and that buys us months, not a year. And there's a lot of services that are really critical, and it's just going to be tough. So just the more that we can be clear that if the state wants the largest and densest population, the economic engine that powers and the biggest contributor to the state in terms of revenue every year, to be able to open up businesses quickly, we need to be resourced to do it. But until that happens, I've got to work with, what I've got to work with. So about 200 seasonal employees, and there will be more to come.
Thanks, County Executive Abele. Next question we have is from Brittany Lewis with CBS 58. This is for Dr. Weston or Health Officer Roush. In order to prevent septic systems and pipes from clogging up, is it sanitary to throw away used wipes versus flushing them down the toilet?
I'm not sure this is my area of expertise, but I would say that flushing wipes down the toilet and clogging our sewage system is probably a bad idea. And disposing of them properly is probably in the garbage, I would imagine. I don't know if Darren Roush from the Health Department has other insight there.
Yeah, not my area of expertise either, Dr. Weston, but I understand MMSD might have put something out about that early in the Safer at Home order and basically encourage people to only flush things that were appropriate to be flushed, like toilet paper, and even discouraging the flushing of flushable wipes.
That is correct. This is Mayor Kennedy. I'm an MMSD commissioner, and we have been stressing for several years that flushable wipes are actually not flushable and are bad for the sewer system. So yeah, only toilet paper should go down the flushable wipes are not really flushable. No wipes should go down through the toilet or into the sewer system.
Thank you. I'm sure MMSD will appreciate that question being asked. So next question I have is from William Miston. He asked for Mayor Barrett or Dr. Weston. It was announced that Governor Evers, along with other Midwestern governors, have formed a pact to reopen the economy. How does Milwaukee play into this, and what conversations have you had regarding this? Today, the White House outlined a phased approach to restore commerce with benchmarks requiring declining infections and strong testing, each phase lasting 14 days to ensure the outbreak doesn't accelerate.
Well, I can start out there. I think it makes a lot of sense for the state of Wisconsin to be working with other states in the Midwest. Illinois in particular, we obviously have a long border with there. We're close to Chicago. Chicago's rates are essentially 3 times greater than the rates are here in the state of Wisconsin. And there are a lot of people who travel back and forth between Wisconsin and Illinois. Michigan has a significantly higher rate than Wisconsin does as well. Interestingly, Minnesota has, on a per capita basis, the lowest rate of any state in the country. They have been successful, and even though Illinois' rate is 3 times greater than Wisconsin's rate, Minnesota's is essentially was very aggressive and acted quickly. The other interesting one in the Midwest is Iowa, of course, because their governor did not issue the stay-at-home orders, and they were significantly lower than we were several weeks ago. And in the last couple of days, their rate now surpasses the rate here in the state of Wisconsin. So again, I look at that as testimony to how important it is to have the stay-at-home rules. I think Ohio, another part of this agreement. Governor DeWine there was one of the leaders, and certainly among the Republican governors, the most aggressive. And although their rates are higher than ours, their rates are lower than Michigan's as well. So a lot, I think, is dependent upon the Midwest and how we interact with each other. But it makes sense for us to be working with our partners here. You're seeing this in the northeastern part of the country. You're actually starting to see this in the western part of the country, because you have these regional economies that are interconnected. And so I'm actually pleased that the governors are talking to each other. And I think that that's very, very important.
I would agree. I think the only thing I would add to that is I think one of the successes on a smaller scale in our community is the collaboration. And I think we've seen it with our fire departments. We've seen it with our health systems. We've seen it with our health departments. We see it on this call. We have leadership from our largest city, leadership from several of our municipalities, leadership from our county. And so I think that's been one of our keys to success so far.
Thank you. Anyone else want to add to that before we move on? Okay. Next question is from Rebecca Klopf, who shares the sad news that longtime national award-winning journalist Eugene Kane passed away today, possibly connected to COVID-19. Could Mayor Barrett and County Executive Abley or anyone else who knew and worked with him talk about what Eugene Kane meant to the community? And I see here that President Montgomery, you responded in the chat. Would you like to respond first to that? And you're on.
Yeah, I just saw it in the chat, and my response was, "Oh my God." I knew Eugene. I knew his sister. I remember a few years ago where he had a major health crisis, and he recovered from that. And even though he wasn't actively writing and reporting, he was still very active in the community and sharing information. So it just brings back, you know, we don't know who this is affecting. I know Judge Derek Mosley recently shared his experience. So these are people that I don't know, you know, if this was related to COVID, but the bottom line is, what can I do to make a difference? We can't, for me, this is very stressful. Not only to hear people that are suffering and dying, but then not to be able to even celebrate their life because we have to still exercise social distancing. So as we hear these stories, it needs to make us stop and pause and really think about the decisions we're making and how they may affect somebody else. I may be just fine in my home, but other people need to practice and do the same thing. So safe distancing, washing our hands, making sure that we do our part. I just can't, this is heartbreaking. And then to see it on the chat is even more difficult. So I don't know, the mayor and Chris may have something to add.
I'd love to. Gene was just a great guy, someone I had the privilege of knowing for a long time. And for anyone who read his work, Gene held this community accountable. Gene called people out and he called institutions out and he called out what needed to be called out. He also celebrated what was good, I know, because I think I had experiences of a bit of both of those with Gene, but I always liked him. And, you know, when he called something out, it was never simply for the goal of saying, I'm right, you're wrong. It was with the goal of pointing to something better. And it is definitely, it's a loss. It's a loss, especially honestly right now. You know, I mean, I know I'm a broken record on these calls about what we should be talking about every single time we talk about coronavirus in Milwaukee, the massively disproportionate impact on the African-American community. If people want to honor Gene Kane, I think he'd probably say you can start by calling people out and looking for a solution. The way he always did. Like Wanda, this is the first I heard of it. I didn't know before, and I'm sad to hear it.
Mayor Barrett, did you want to add a comment? Looks like we may not have a good connection to the mayor at the moment. So I'm going to move on and we can come back to that if wanted to make an additional comment. So
Mayor? Brian, this is Tom Baird, if you can hear me.
yep, now we got you. Go ahead, Mayor Barrett. Unfortunately, we lost you there, and so we'll come back to you in just a second after we get that connection sorted out. So next question I have is from Megan.
Brian, if I can interrupt there, I just want to,
Yep.
I was thinking for
There
a
you go.
second there.
Please go ahead.
But Eugene was an incredibly gifted writer, and more importantly than that, he was an incredibly passionate person about equity and justice in our society and specifically in our city. And like the other speakers, I knew him for decades. There were times we worked closely together. There were times when he challenged me, challenged the city. And every time he challenged us, I took it very seriously because I knew he was speaking from a place of wanting to do what's right for the people in this community. And it is heartbreaking to see that he's passed away.
Thank you. Next question I have is from Megan Carpenter. And she asks, actually, maybe I'm jumping ahead. Excuse me. I think I was, yeah, so I skipped over Mariella. This is from Mariella Godinez. And she asks, thanks for keeping our community safe locally because we really need to follow the stay-at-home order. I'm sorry, that's actually not a question. my mistake. Feel free to read that comment in the chat. The next question is from Megan Carpenter, who asks, when will more testing be available? Is this known when more testing will be available? Also with the drying up of the SBA, I believe that Small Business Administration, how will small business owners and those in the entertainment/service industry be helped on the local and state level?
Well, I'll address the first part. The question was, when will more testing be available? I'm going to do everything that I can to get more testing available, not in weeks, but in days, because I think that is one of the keys to what we need to do. And so I've been in constant communication throughout this entire day with the decision makers and anyone who I think can be helpful in getting us additional testing here in the city of Milwaukee. With regard to the drying up of the SBA, I'm hopeful that Congress will act again. It's clear that that first allocation, which was a large amount of money, went to primarily businesses that had banking relationships. And what we know is that a lot of businesses, small businesses in particular, may not have those relationships. And that makes it more difficult.
Yeah, I'll just add on that. The mayor's entirely right. This is something I've been working with a lot of small businesses specifically. And unless you have a good relationship or you know somebody at a bank, because there was so much demand, it's lined up really quickly. The people who had existing relationships or businesses who did, and had sort of the level of sophistication and capacity to get towards the front of the line did. But also, I agree. It's my understanding, and I've been talking with our delegation pretty regularly, that Congress is seeing how quickly we went through that, and as both an illustration of the need, but also they've realized they're also aware of that trend, that not as nearly enough of this got to the small businesses it was directed to. So obviously, and I know the mayor feels the same way, we will do everything we can to make sure that Wisconsin small businesses get as much as we can from the federal level, and when that funding comes, as much as we can to share how to access that. And again, there's some good resources out there. But yeah, I think it just shows that it's awfully difficult to manage massive amounts of money like this. But it, as always is the case, is harder to manage through it when you're a small business as opposed to, a larger business.
Thank you. So I'm just going to ask Mariella Godinez, if you want Mariella to ask your question, I'm wasn't quite phrased as a question, so I'm not sure if you were just making a comment or if you did have a specific question. But if you do want to ask a question to any of the presenters, feel free to take yourself off mute. And okay, I see it here in the chat. The question is there going to be any type of economic relief to undocumented immigrants and refugees similar to Illinois? Anyone know how to respond to that?
I'm not familiar with what they're doing in Illinois, and I'll certainly look into
Yeah.
it.
Okay.
Agreed.
And maybe we can come back to that. And Marielle, if you wanted to follow up with me via email, we might be able to get more of an answer for you after the call offline.
Yeah.
So I guess we will wrap it up there. Thanks everyone for being on the call, and apologies again for the change in topic today. We do plan to come back tomorrow with updates on the situation at the House of Corrections and the jail with some of our experts from the criminal justice community. Thanks everyone for being on the call, and have a great rest of your day.